The statistics will shock you. Opioids are killing thousands of people every year in this country, from every age, demographic, and geographic profile. The warnings have been out there for several years. Why is this getting worse and not better? Let's ask Dr. Dirk Heyer. He is the Chief Coroner for Ontario. Dr. Tara Gomes, epidemiologist and principal investigator for the Ontario Drug Policy Research Network and a scientist at St. Michael's Hospital's Likashing Knowledge Institute. And Zoe Dodd, a member of the Toronto Overdose Prevention Society and program coordinator for the South Riverdale Community Health Centre here in Toronto. And it's good to have all three of you on this program tonight for a timely and important conversation about something that is of deep, deep concern. And to that end, Sheldon, can you bring up this first graphic and let's just show people how this issue has morphed over the last several years. If we go to 2016, there was a 19% increase in the number of deaths because of opioids compared with the previous year, 2015. And then if you go to 2017, there was a 46% jump over the previous year. If you go to 2018, another 16% jump. That's a total of 1,473 deaths last year. If we look at this year, we have stats available from January to March, and there's already a 3% increase compared with the previous 3 months, October to December, at the end of 2018. The graph continues to go up and up and up and up. Chief Coroner, what do those numbers mean to you?
First off, I just want to recognize that the numbers are representative of a person. So every count is one person who's lost their lives, the family have lost their loved one, the community has suffered a loss, the care providers have all suffered a loss. So I don't want to ever lose that. But certainly when we talk about numbers, it seems to get lost, the individuals. But what this means to me is this is one of the most significant public health problems that we have in Ontario history, certainly in recent times.
In history?
Yes.
So this is not just a today problem. You think this has historic implications?
This is a tremendous loss of lives, and each of the lives that is lost is a preventable loss of life, and often it's involving upwards of 50% of the deaths involve those between 25 and 44. So these are young people whose lives are being taken very early in their young lives.
Zoe, what do the numbers say to you?
I mean, I agree with Dirk that these numbers are about people, and we haven't had anything like this. I mean, there have always been overdoses with people who use opiates and other drugs, but never like this. This is like quite extreme. There's a lot of losses, and some of those numbers represent people that I know and people that I have worked with and people I've been a support worker to, and yeah, the amount of deaths has been alarming and it hasn't slowed down.
Tara.
Yeah, I think along with what Zoe just said, I think that often I'm asked, are you shocked by this? Is this surprising you that this keeps going up? And unfortunately, I often just say no. I just don't think we're having the response that we need to have. And every year we talk with people working on the ground, people like Zoe and others in the harm reduction community who just say it's just getting worse. We're not finding pathways and ways in which we can actually start to address this harm and start to really turn that tide. And until we can do that, these numbers are just going to keep climbing.
The numbers do climb by double digits every year over the last few years, but there is that one huge jump of 46% in 1 year. Mm-hmm. How do you folks account for that?
I think a lot of it is when we started to see the shift towards fentanyl being, contributing to these deaths more and more. And this is a very potent opioid. It's one that, when it came and entered the market, really started to lead to overdoses that were actually causing death. And so, historically, a lot of this issue, it can be argued, started or was contributed by the prescription opioid epidemic that we saw. So we saw rising prescription opioids used. And that contributed to some of the harm and some of the deaths that we saw. But, when we started to see this huge increase in the deaths, a lot of that was when fentanyl entered the market and just the contamination of that drug supply and the huge amount of harm that it caused.
Did you feel that on the front lines, like an exponential increase in that year?
I mean, we were seeing it 2016. We were already seeing people die suddenly of deaths, and we were saying to people that, yeah, there's fentanyl, there's something in the drug supply that is killing people. And when autopsy reports would come back, they would show that the person had used heroin with fentanyl, like fentanyl had been laced with it. And then we just saw fentanyl completely take over the market, and we were sounding the alarms. I mean, the coworkers that I work with, we identify bodies, we organize funerals, we are the people holding memorials. At my workplace, we built a 5-foot copper flame in memorial of people who had died because of the drug war. We had already been seeing it. We started to lose our own coworkers. It just happened so rapidly. It wasn't, but it had been going on, and we were trying to prepare for it and trying to let people know that this was happening. But the amount of time that it takes for the data to come back was what everyone else was waiting for. Meanwhile, we were saying, this is happening, this is a crisis, we're in an emergency, we need help. And that help just wasn't coming soon enough.
She mentioned 2 drugs, and I want to get a better understanding. One of them's legal, one of them's not. Like fentanyl's legal and heroin's not. So can you characterize the kinds of, what are you seeing out there?
What we're seeing is fentanyl that's produced non-pharmacologically. So
illegally.
It's produced and sold illegally. It's not the prescription fentanyl that we're seeing significant loss from, is our understanding, because we've been working to try to understand the source of the drug that people are dying with. And what we know is that fentanyl, and Zoe's right, we took some time to get the data. We changed our process at the Office of the Chief Coroner to be able to get more robust data, but also much more timely data. We heard from those in the harm reduction community and those from people that have lived experience to try and understand the information more effectively. Fentanyl is a dangerous drug, especially when people don't know that's what they might be taking. Not only are we seeing fentanyl in upwards of 70% of the deaths, we're now seeing a significant increase in carfentanyl, which is a drug that is a relative of fentanyl, and it is produced for veterinary medicine, but is not produced for human consumption. So again, it's not being sold legally. But what we've seen in the first 6 months this year is 300 deaths from carfentanyl, whereas last year we saw 95, and the year before 80. And this again has even more potency and therefore even more potential risk of toxicity for those using.
Are people doing their own chemistry on this?
As far as developing the medication, I don't think we know that. I don't think we know the supply of how these drugs are getting purchased or obtained by those who choose to use drugs.
Zoe, what are you seeing?
You know, I think that fentanyl could be manufactured here. So you could have a lab here in Ontario manufacturing fentanyl, which would make a lot of sense to have it manufactured like in Canada, so then you don't have to cross borders. So, you know, with heroin, with that drug supply, people have to grow poppies. You have to get them from farmers. You have to take heroin across borders. This way, like a substance that's like chemically made could be made in a lab, made fairly easily by someone who knows how to make it. I mean, fentanyl was first created by Janssen Pharmaceuticals in the 1960s. These patents are available. So,
but doing that extra chemistry to make it carfentanyl, for example, to make it even worse,
yeah,
is that something you can do on your own?
I think that someone with the knowledge could know how to do that, and you can make a lot of money by selling carfentanyl, fentanyl. Fentanyl has completely taken over the drug market on the streets. The people who are selling on the streets are not the people that are manufacturing and bringing in fentanyl into this country or the people that are buying it in massive bulk. The people on the streets are just distributing what's available, and this is about supply and demand. There is a demand for other opiates, but the only thing available to people is fentanyl now. It has completely taken over. And, you know, I was thinking about what Dirk was saying about carfentanyl, and it actually made me feel incredibly emotional because I work at an overdose prevention site, and the first 3 months of this year was an incredibly hard time at work where we'd gone from seeing 29 overdoses that we reversed in December to 89 in January. There were days where we had like 10 overdoses a day. They were very hard to reverse. People were going down really quickly. They'd stop breathing really quickly. Their bodies would get really rigid. And it took a real toll on many of us who were working front lines because we also didn't have like enough staffing, enough hours. There was no one to talk to. There's no task force in the province of Ontario to bring this to a table and say, look, this is what we're seeing right now. This is what's happening. And we knew that paramedics were getting more calls. We knew it had to be carfentanyl, even if we weren't getting the drugs tested just by the presentation prohibition of the overdoses.
Gotcha. Now, fentanyl is a legal product. It is legitimately made by pharmaceutical companies. What happens after that? Okay, potentially a different story. But I want to know how much you hold at the feet of Big Pharma responsibility for the problem that now exists.
It's an interesting question. I think, going back to Dirk's point, the fentanyl that we're seeing now isn't manufactured by pharmaceutical companies in terms of what is causing the deaths. But I do still think that pharmaceutical companies have a huge role to play in where we are now in Ontario and across North America. If we go back to the early 2000s, we saw that there was a huge push by pharmaceutical companies in marketing of prescription opioids as a safe long-term option for managing chronic pain. And a lot of data was hidden and evidence was hidden around the harms of these drugs. So I think that there are a lot of people that got their first exposure to opioids through prescription opioids, through that marketing, and didn't actually understand the potential risks that they might encounter with those drugs. And some of those people are now, because of shifting policy, more difficult access to prescription opioids, entering into accessing, opioids through other markets, through the illicit market, which is contaminated with fentanyl, with carfentanyl, and they're overdosing. So while the fentanyl that's actually killing them might not have been made by a pharmaceutical company, a lot of the time the way in which they got there had some impact and was driven by a lot of the marketing practices by pharmaceutical companies.
Well, I do want to follow up with the chief coroner on that, because it will not have escaped your attention, of course, that in Oklahoma last month, there was a ruling that Johnson & Johnson, which was the pharmaceutical manufacturer down there, had a judgment go against it in court north of $500 million, because the suggestion was, or I guess what the court found, was that they were culpable in the explosion of the misuse of opioids in that state. Okay, true enough, the plaintiffs in this case wanted $17 billion, but they settled for north of $500 million here. How would you characterize the significance of that ruling?
Well, I think it continues to bring the attention to what Tara was talking about, which is what are the contributors to this very complex problem? And some of those contributors certainly were the pharmaceutical companies and the work that they did initially, working with others to help to lead to further prescription. But I think it's beyond that. I think it's a key point that brings the attention to one of the factors that have contributed to this. But this is a complex problem with lots of upstream things to be considered. What about people's well-being? What about the trauma that people have suffered? What about their determinants of health, their economic status, their home status, their employment status, their education status?
If you improve on all that, you don't need the fentanyl to begin with.
Well, I'm not sure that I would be
that's
that
an
specific.
oversimplification.
Yeah, I think that's an oversimplification. But all of these factors are very important to consider in the complexity of the problem. There are people who use drugs for reasons that are their reasons. And what we as a society shouldn't be judging about why people are using drugs, but it's to provide the understanding of factors society-wide and systemically on how can we provide opportunities for other things and management of their concerns.
Now, I notice, Zoe, he's the chief coroner, so he's got to be a little bit careful about laying all this at the feet of Big Pharma, but you're not the chief coroner. You're on the front lines. My hunch is you're not going to be quite as dainty about it.
I mean, I think that Big Pharma play a significant role in the overdose crisis that we are in, but they're not the only players. And I think one aspect of this that we don't talk about is government, and actually government who enact prohibition policies. So they're the ones who create the drug laws. They're the ones who created the Opium Act of 1908 came from the government. And so I think we can't just let the government off the hook as well for creating policies that also contributed to where we are right now.
Let me understand that.
So
what government policy would have contributed to the fact that we have an opioid crisis right now?
So during the prohibition of alcohol, people were poisoned from a tainted supply of alcohol. This is similar. If you have the prohibition of drugs, we have people tainted by the prohibition of drugs. It's really similar in the way we have policies. The policy of 1908, the Opium Act, had nothing to do with drugs or the safety of drugs or people. It was about labor. It was about racist policies that were enacted because they wanted to target Chinese workers after the gold rush and after the railroad were built.
But that's not the case today.
we have similar laws today. We have laws that criminalize people for using drugs. We have laws that go after people. We lock people up in jail for what they put in their bodies. All of those policies contribute to the well-being of individuals who are using drugs. Everybody uses drugs. I'm sure you drink wine. I'm sure you drink alcohol. I drink alcohol. Lots of people use alcohol. Now weed is legal. Weed and heroin used to be the same. When you would go before a judge, you would be sentenced at the same for those drugs.
Are you saying that if you legalized all drugs, be they alcohol, beer, heroin, some of this problem goes away?
Yeah, I am in favor of legalizing and decriminalizing all drugs because I think that the policies that we have, the criminalization of people who use drugs, has contributed to the overdose crisis. It contributes to the stigmatization that people feel and the discrimination, and is why we haven't had a government response as we should have for this catastrophe and carnage that we are in. We scapegoat, we blame people, we blame them for using drugs, and yet people use drugs, and they have since like millennia.
Can I get you on that? Does some of this catastrophe go away if we legalize all drugs?
I think certainly, there's a lot of evidence that decriminalization of drugs for personal use is a huge factor in potentially addressing this issue. So there are other countries internationally that have implemented different types of decriminalization policies and have shown that this changes the supply. It provides people with not only safer supply to avoid the contamination, but also takes this out of the criminal justice system, which it can be such a cycle for people and creates so much more harm when people come in and out of that criminal justice system. And it can also save money by avoiding that criminal justice system that can be reinvested into other programs and other, services for people, like Dirk said, around the social determinants of health, around, vulnerable, unstable housing, around some of those other aspects that could actually support people and help them instead of just putting them back into the criminal justice system.
If I ask the Chief Coroner for Ontario if he's in favor of legalizing all drugs, he's going to dodge the question, isn't he?
I'm not going to dodge the question, but it's not a question that I can answer. And the reality
How is that not a dodge?
Yeah, exactly. Well, it wasn't quite as dainty as the last one. But the reality is we're independent arbitrators of data.
Right.
And we analyze, but what we do is we're trying to get the best is a bad term in death, but the best information possible as soon as possible to be able to provide that to those in a position to make change.
Okay, tell me this then. The Oklahoma ruling, and there will be others like it around the United States. I think there may have been one already, other rulings in American states. Do you think they can have an impact on what happens here?
I honestly don't know. I honestly don't have an answer to that question. Again, I think what's really important is that we all work together, government, those in death investigation, those who deal with the unwell. So illness is as important or more important to understand how significant people are in suffering toxicity from drugs or from drugs as opposed to death. Death is unfortunately horrible and very, very terrible, but it is still the tip of the iceberg for the number of people that are unwell, emergency department visits, hospital admissions, those who suffer illness and difficulties otherwise.
Tara, I think I remember anyway, what year is it? 2003? We had SARS in 2003, I think. 44 people in Toronto died. 44 people in Canada died. I do remember the provincial government of the day, they called a summit. There was a very forceful response to what was seen as a very scary outbreak, which we didn't have a handle on. And, supposedly, things in the healthcare system changed as a result of that SARS outbreak. Has anything changed in the 16 years since all that happened that you can point to right now and say, maybe we ought to take that approach to this?
That's a great question. I think when we make that comparison to SARS, I think it highlights what's already been said around the stigma around this issue. We had 44 people in Canada die from SARS during the SARS epidemic. 100 times that many people died of an opioid overdose in Canada last year alone. And this is an issue that's been going on for decades now. And, I think when we think about it that way and the amount of resources and, focus that the political sphere and the public gave to SARS and compare that to what we're seeing with opioids, I think that is where we see that huge impact of stigma and that us versus them mentality of, that's not something that's going to impact us. That's something for, people who use drugs and, it's some sort of moral failing. And I think that if we can't see past that and convince politicians and the general public to see past that and see the people that this issue is impacting, and also see all the other issues that encompass them around histories of trauma, around all of those social determinants of health, around housing and other aspects of society, then we're not going to make any headway. And so we really need to start addressing that.
Well, in fairness to the members of the public and in fairness to politicians, I suppose, they tend to react to what media put on their radar screen. And Sheldon, here, middle of page 3, let's put this graphic up if we can. There is a heck of a lot of attention, certainly over the summer, to the homicide rate in this province and across the country. But in the province of Ontario, last year, we had 200 homicides. How about deaths by motor vehicle-related causes? 650. Opioids, 1,475. If the action ought to go to what clearly is causing the most amount of carnage, it sounds like opioids should be getting more attention. Why aren't they?
I mean, honestly, I think that over the past decade or so, there has been attention to this issue. I've spoken about this issue for years now, and I think all of us around this panel have. But sometimes I worry that we talk about it so much that people just get used to this and they just kind of think that this is just status quo now. And to me, that is a huge concern too, that this can't be status quo. We can't just accept that this is the way it's going to be, because people are dying every hour of every day. And so, it's so hard when you compare it to those other statistics, because people do talk about, homicides that come up. They're more sporadic, and so it catches the news a little bit more. But, it's almost this risk of us just getting too comfortable in the fact that this is happening and not actually seeing the urgency anymore.
We're saturated with it.
Yeah.
Okay, politicians are calling press conferences, it seemed, every other day during the summer to make some new announcement about how to handle gun crime or murders. We know that the campaigns against drunk driving have been intense and very successful over the years. Opioids. Twice as many people dying of opioids as motor vehicle-related deaths last year. Where's the outrage? Where's the intensity from the response from those who are in positions to make decisions on this?
Well, I can't speak for them, but I can speak for what we're doing at the office. And we recognize this as a significant problem, and we're continuing to work as promptly as we can and to bring the information. I think Zoe's point is quite earlier point that she made. They knew that there was trouble at the consumption treatment service when they saw during January and February and March people suffering much more significant overdose and much more quickly. That's the kind of information that we need to work together to bring to the forefront as quickly as possible to allow people to understand the challenges. We investigate death, and that takes us a while to get that information. And it's frustrating because every person that dies and every investigation we do is a story of a person. And those stories are profound. And so what we're trying to do is to work with everybody to recognize that it's not just waiting for us to give the numbers, but to work on what information that we have as quickly as possible. We try to bring it out publicly. I'll respond to any media request whenever to explain what we know. We have it on a website that's publicly accessible, but I don't know how frequently that's at, but certainly not infrequent. But really to bring this information forward to allow those with the opportunity of early intervention, and then more boldly a broader intervention strategy and a prevention strategies are of key importance to us.
Zoe, I want to ask you a very direct and very uncomfortable question.
Okay.
Do you think officialdom cares less about these deaths because they say it's just a bunch of junkies and they get what they deserve?
I think that is true. I think that there's people in politics and in power who believe that. And I think that there's people in our society that also believe that. Like when you read comments on articles, you see people say horrible things like this is natural selection and just let people die. They brought this on themselves. And I've had people say similar things like that to my face. And I think that also shapes political will and also responses. We don't have an overdose task force in this province anymore. We had one that ran during the Liberal government, but the Conservative government decided not to reconvene it. So we haven't met in well over a year. During SARS, they had phone calls every day. They had meetings weekly. We had flu pandemic planning. There was all sorts of things that happened that just have not happened in the overdose crisis. There's no one to talk to. There's no one to call and who's in charge of this crisis in this province. If you were to ask people in the Conservative government who's in charge, you will get probably a few different answers. And that's really problematic because we have this crisis raging on, and we need people to be in charge, and we need to be taking it really seriously. You know, I know that the overdose prevention sites, which are now called consumption and treatment services in Toronto, you know, they reversed over 2,000 overdoses from their establishment in August of 2017 till like a few months ago is the latest statistics that I saw. That is so many overdoses reversed, and there are communities that really want to build these structures to help them with these emergencies. It's just not happening. It's not happening fast enough. And there just isn't enough on the ground. And I will say, as a worker, this has been really challenging to work in this. To work in this and to just see like a total disregard for human life. And these are like people that we know, and there are people advocating and fighting, like Moms Stop the Harm, like moms who are out there fighting for other people's children because they've lost their children. These are preventable deaths. This is accidental. And that's why politicians are also responsible, because their policies are why we have fentanyl, because border security couldn't stop the flow of drugs, and there is a supply and demand. And if you take people off of their pain medication, which is safe, people are going to look for what they need to deal with their pain. So it's all of these things combined. And so there is a responsibility that lies at the foot of all of these people that we put in charge, that we pay for them to be in charge at different levels of government to deal with this crisis, and it just hasn't happened.
Would an opioid czar at the cabinet table make a difference?
Yes, I think Zoe should just take on that role. I think perhaps, I mean, it's hard to say, but I do think that we need that attention at the policy level, but we also need to talk to people on the ground. I think just having a czar who thinks that they have a sense of the complexity of this issue and
who
can
coordinates all the response? That's the idea.
Potentially. So, I mean, I think it depends the approach that person takes and whether they only listen to other people within government, whether they talk with the clinical community, people in harm reduction, people with lived experience. So, you know, it's really hard to know until you design a model that takes into account the complexity of this issue and the fact that a lot of the time, what people say are unintended consequences of some of these policies that have come out were predicted by people on the ground who are living it. And so had policymakers, perhaps researchers like myself and others, being more proactive and spoken with people with lived experience, perhaps we could have avoided a lot of this harm by developing better policy, by better contextualizing the data and the research. And so I think that's the direction that people like Dirk, that people like myself are trying to take moving forward, is to say we can learn so much by talking with people who are living this right now. And we really need to work with them and help bring those conversations up to whoever it is that is in a position to make change, because that hasn't been happening in the past.
My hunch is you're not the problem, though. So what is the problem?
Well, I think the problem is that, other people who are in a position to make change, I am personally not, unfortunately, aren't taking that approach. And there has been this shift as well away from, some ground that have been made in terms of talking with people through task forces, through other ways to try and understand that experience. And I think we need to reinvigorate that, and we need to make sure that that's integrated throughout the policy discussions that are occurring.
It's always dangerous making analogies, but I'm going to try another one here. If you go back to the mid-1980s and people started to get sick with acquired immune deficiency syndrome, AIDS, and started dying in large numbers, and there were people in our community, broadly speaking, some who said what you just indicated, which was, well, they're just gay or they're intravenous drug abusers and they deserve to die if they can't, if they can't manage this situation. And it took a while before decision makers came. I think Ronald Reagan, the first 4 years of his presidency, didn't utter the word AIDS once. It took a while for people to sort of wrap their heads around the notion that this is an epidemic and something has to be done. And eventually, lots was done, and AIDS is not the death sentence today that it certainly was 35 years ago. Can we replicate that approach now?
I think there's a couple of things that make the comparison a little bit more challenging. Both with SARS and with AIDS, there's one key factor that led to both those, and that was a form of infection. The mobilization and the response, I hope we can replicate that. The complexity of this problem is far greater than an isolated single problem, but that doesn't mean that we shouldn't be mobilizing. And I think it's more than listening, it's more than talking, it's working together. And we all have to be working together and bringing all of the perspectives that everybody has, those people who use drugs, those who are in the harm reduction world, those who are in the medical world, those in the government, death investigation. Everybody needs to come together, and there have been efforts to do that.
Okay, well, who's not inside that tent already? I thought all those groups were inside the tent already.
They're inside the tent, but the coordinated and the ongoing and the continued momentum and the continued momentum along a same pathway together is what's challenging. And I think, again, it's a lot because of some complexities, the multiple complexities. There are many contributors to the deaths. There are some single avenues that people are advocating for, but they don't necessarily consider the multiplicity of everything that's contributing.
What do you think of the AIDS analogy? Am I pushing that too far?
No, I think that it's actually not a bad comparison in terms of when we think of othering people and how during that time the amount of homophobia that contributed to lack of response around AIDS, and also drug phobia, drug user phobia. And the overdose crisis is larger than when we were at the height of the AIDS crisis in the 80s. And what it took actually for a response was activism. And that activism has occurred all across this country. There are people who set up sites on their own. I was part of a group of people who set up an illegal safe injection site in a park to show the government how you can create an overdose prevention site and how you can just go ahead and do that. We did that for a whole year. We volunteered, 150 people in Toronto volunteered. Another tent opened up in Ottawa 2 weeks later. People are fighting in Halifax, they're fighting in Thunder Bay and Peterborough. People have taken upon themselves to actually respond to the emergency that we're in, similar to what happened during the AIDS crisis.
I hear you, Zoe, but I'm gonna push back a little bit. The AIDS crisis and the response to it by the community, the demonstrations, the direct action on politicians, the attempt to put this on the public's radar screen was far larger than what's going on right now in response to opioids. I don't know why. Maybe you do. Maybe the opioid community is not as organized in trying to get a response going as the AIDS community was. I don't know, but it doesn't feel as big today as it did 35 years ago.
I mean, I agree with you that there was things on larger scales, but I do think that we have been, I think people who have been doing some direct action activism have been able to do some certain things. So they were able to open sites. Those sites in the province of Ontario wouldn't have, other sites, safe injection sites would not have opened if it wasn't for people taking upon themselves. I think that wouldn't have occurred how it has if it hadn't started in Vancouver when people first started doing that by putting a tent in a laneway. So I think that there has been, we haven't had maybe on the large scale that AIDS had, but we do have people who have pushed, and I don't want to forget about their activism because we have come this far. People are trying to get safe supply out. They're trying to do different things now to push the envelope, to push things further, and that, and there are also people who are responding on the front line. But yeah, we haven't had as much of a response as say, like the demonstrations they had during AIDS.
They were big and they moved people.
They were really big. Yeah, I mean, We've had disruptions at Queen's Park. We actually copied an AIDS Action Now disruption where we dropped banners in Queen's Park and were taken out of there. So, I mean, people have done some things. We work with AIDS activists from that time, have spoken to them. And one of the things that I've had in conversation with a lot of older AIDS activists is this talking about grief, what it was like to lose so much of your community and the people that you were organizing with, because we personally have lost so many people, and we look to those people to talk to us about how did you get through it? Did you think it would ever end?
Okay, I'm going to do this. Who was Ang?
Ange. Ange was my friend, and Ange actually died a year ago today.
From?
An overdose. She was alone at home.
How old?
She was in her 30s. She was in her late 30s. She was loved tremendously by her family, by her sisters, by her brother, by her parents. She was a woman that at one point I was her worker, and then we became not worker. At one point I was her worker, but then we became co-workers. She helped to organized the National Day of Action, the first one we did across the country. We organized a National Day of Action in 9 cities. She helped organize that, and then she became a worker at St. Stephen's Community Center, where they have an overdose prevention site that the government didn't want to they didn't want to fund it, but they're still operating until March.
Who is Claire?
Claire was an organizer in Ottawa. She just recently died 4 days ago. She was a woman who fought really hard for her community.
How'd she die?
I don't know yet. So she was also addressing the overdose crisis in Ottawa, was a part of that organizing, was contributing around, fighting around rights for sex workers, and she worked as an HIV/AIDS outreach worker, and she's just an incredible person that is now gone.
Who's somebody nicknamed Pops?
Pops was when we set up tents in the park in Moss Park on August 12, 2017.
Downtown Toronto.
In downtown Toronto, Pops walked over to us and said, "What are you doing?" We said, we're making an overdose prevention site. We're showing the government how you respond in an emergency. And he said, "I want to be a part of that." And so Pops came every single day while we were there, and he overdosed and died homeless in an abandoned house near Queen and Spadina.
How old?
A few months ago. He was in his 40s.
One more, Rafi.
Rafi was my colleague of 13 years and my mentor. He started the counterfeit program at South Riverdale Community Health Center. He was an amazing human being who fought for the lives of people who use drugs. He's internationally recognized, won lots of awards, wrote an amazing book about harm reduction and work.
What happened?
He went out to a meeting in Vancouver about supervised injection services. He went to go and talk about what we were doing here in Ontario. He overdosed and died in the hotel and never made it to the meeting.
Overdosed on what?
Fentanyl.
How old?
He was 60.
Well, that's 4 names of the more than 1,400 who died this past year.
I could give you another 100
I know
people.
you could. I know you could.
Yeah.
That was hard, but thank you, because we have to remind everybody these aren't numbers. These are real people with real names and real lives.
And they're people who work really hard in the community, and so when we lose them, we lose so much, and their families have lost so much, their friends, all of us. It's been tremendously heartbreaking, and then you have a workforce that are working in this much grief, trying to respond, not getting the response we need, and they carry that every day that they go to work. We don't get a day off. We find out someone dies, and you're right at work dealing with the emergency that we're in.
I want to thank all of you for coming into TVO tonight and sharing your expertise with us. Zoe Dodd, Toronto Overdose Prevention Society, Dirk Heyer, the Chief Coroner for Ontario, Tara Gomes, Ontario Drug Policy Research Network, and at St. Mike's Hospital here in Toronto. Thanks, all of you.
Thank you.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.